Dr. Dan Purser here again, danpursermd.com if you want to check out my website. Low testosterone in women. Most doctors don't even check testosterone in women or don't think it's important. It's very important. It's what gives you muscles. It's what helps your joints. It's what keeps your, sorry, kind of a touchy subject, but keeps your vagina moist and your libido strong. It's very critical. If you have dryness and dyspareunia, if you're dried and cracked down there and in agony, it's because of low testosterone, not because of low estradiol. Okay, so let's talk about the root causes of that low testosterone. Of course, menopause being the most common cause. That's when women, their ovaries quit working because they've just kind of reached the age of senescence of their ovaries. They just fail, and your testosterone levels drop. So you get osteoporosis, you get a dry vagina, you get scrawny muscles. A lot of bad things happen. Testosterone really doesn't have a downside in women. It's very, other than maybe if you take too much of it, you might get a breakout along your jawline. And the best way to take it's creams, not shots. You got to use a compounded testosterone cream. There's not an androgel for women. So if you're menopausal and don't take the pills, that's really bad. It massively increases your risk for breast cancer if you take the ester test. So you got to take the cream. If you're younger and you have low testosterone, it could be either be because of ovarian trauma or pituitary trauma from a car wreck, or ovarian trauma from a delivery, or some other physical trauma you've developed that has damaged your ovaries. You got to consider trauma, menopause, or a vitamin deficiency. I see that a lot, especially in younger women. The vitamin deficiencies are usually caused from genetic errors, such as MTHFR causing a B12 or folate malabsorption problem. At a cellular level, you can't absorb zinc, B12, folate, serine, glutamine, other amino acids and vitamins that are critical to the production of testosterone. I see this in young men, I see this in young women, especially here in Utah where everyone has blonde hair, blue eyes. If someone comes in your office and has blonde hair, blue eyes, or green eyes, you better think MTHFR. If you have blonde hair, blue eyes, and you're tired all the time, and your testosterone zone, you're a woman or a guy or male, you better think that you might have MTHFR and you're not absorbing B vitamins correctly and a lot of amino acids that you really need in your pathways to build testosterone. If you have more questions about this and want them answered, you can get a 23andMe, get that looked at, or look at it yourself. Get my book, The 85% Solution, still #1 in the genetics section on Amazon, or call my office and set up an appointment. We'll talk about it. I'll tell you your options for treating that vitamin deficiency. You got to take the right kind of vitamins, well designed for those pathway errors that occur from your genetic error of MTHFR. And then it can raise your testosterone levels up eventually too. So nutritional, genetic, trauma, or menopause, 4 causes of low testosterone in women. And someone's got to figure out why and how to treat it. Remember the bad side effects that occur from having low testosterone: dry vagina, weak muscles, scrawny muscles, osteoporosis, which is a serious problem, or osteopenia, and other issues. So contact me if you need any help, or get my book, The 85% Solution, or my book, the program 120 Part B for women. This is Dr. Dan Purser. God bless and go in good health. Fibromyalgia for decades, no one's known the cause of it. It's been a real mystery. Multiple research projects have been performed trying to figure out what the cause is. We think now it's definitely genetic. You see it in moms, daughters, grandmothers, aunts, sisters, stuff like that.